This is a case of a pediatric cataract, probably neglected. It's become hypermature with calcific spots on the anterior capsule. So here, after initially placing my 2.2 millimeter posterior limbal, in fact I've gone a bit through the conjunctiva as well, incision, I make 2 side port incisions as well, and stain the capsule with trypan blue under an air bubble. I express the air bubble and the trypan blue with 2% HPMC. I make sure the whole air bubble comes off with the trypan blue and pressurize the chamber with the same 2% HPMC. And probably I should have used a higher molecular weight OVD. Anyway, this was what I had. This is an old surgery. I start my rexus with the bent 26 gauge needle as a cystitome. I cannot continue with that, so I go ahead and shift to the Uthrata forceps. And although there is egress of the liquid cortex, I am able to progress fairly well with the Uthrata forceps up to a certain extent. I then put in some OVD again, that is again 2% HPMC, and continue with the microrexus forceps. And you can see there is no nucleus, there is just liquid cortex, that's it. And I am slowly fashioning my rexus, and look at the mistake. It's going on very well, and I have hit a calcific spot which I didn't bother about, and my rexus went away. It's just run away, and I try to bring it back, but there are too many calcific spots there, and rather than having a breakthrough into the PC, I opt for my Vana scissors, which is a little bit difficult to put through a 2.2 mm incision. How I manage and cut the capsule at the runaway point. Aspirating the cortex is no big deal. It's all liquid cortex. It's done within a few seconds. And I then decide to go ahead and place a hydrophilic foldable IOL within the bag. So here I am under HPMC. I am implanting foldable hydrophilic lens, wound assisted, just tucking in the trailing haptic. And I have to move the other haptic away from that area of runaway. So I'm just dialing it away very carefully, making sure I don't put any pressure on the zonules. And once that's done, I put in some pilocarpine, intracameral pilocarpine, because you don't want this lens coming out of the bag post-operatively and getting captured by the pupil. I then go ahead and aspirate all the HPMC. One could argue to put in a 3-piece lens, but that would mean increasing the incision, and I think this lens works well enough. I then put in my intracameral antibiotic, hydrate the incisions, and conclude my surgery. Thank you so much.